I'm Dr. Eileen Henry. I have a natural medicine practice that encompasses Chinese medicine, clinical nutrition, and homeopathy. The truth is most of my patients are smart, and most of my patients come in here extremely well read. I'm amazed at the range of population that is sold on natural medicine. People are coming in with serious pain, diseases, and serious frustrations or with what they have been given in the way of treatment options, or a disagreement with what is being presented to them as a treatment option. They don't even try it, they just disagree with doing those kinds of things. I fundamentally believe that the basis of health is with us at all times. Most chronic health conditions represent a breakdown in the normal functioning and processes of the body. We have come to call those disease. It's possible through proper nutrition, detoxification of toxins, managing inflammation, the inflammatory processes, that we can restore the original functions and normalize whatever we think of as those chronic diseases. So patients visit my office for a range of conditions. Some of those conditions for which conventional medicine offers no cure would be diabetes, heart disease, management of hypertension. And so it's often the case that patients begin to question the necessity of ongoing drug therapy. And, you know, is there another way? There's a lot of data to collect. We want to understand toxic burden, body composition, look at a basic blood panel so that we understand the status of all of the vital organs and how they're functioning, and the immune system. It's important to look at what we're eating as a possible irritant. So, food intolerances, food allergies are also an important piece of what we look at. Once we gather data, and it takes several visits to gather all of this information, then we put that in the context of the symptoms and the original complaints. Out of that, we develop a program. That program often will involve changes in some aspect of the patient's lifestyle. Good. Lifestyle adjustments are a big part of proper lifestyle adjustments are a big part of what I do, absolutely. And everything that I do, I measure the results objectively before and after. We have a device called a bioimpedance analysis, and what it is this electrical current that we run through the body. And with this, we can determine body composition. That is the percentage of body fat, lean, and the hydration status. This is vital information in determining the health of our cells. Usually, treatments are necessary, such as acupuncture or homeopathic intervention or nutraceutical treatments. Nutraceuticals are natural compounds. And it's not just treatment. What I'm, of course, advocating is active participation on the part of the patients. So there is usually something within our daily habits that we need to correct. Sleeping, the quality of sleep, stress and management of stress is a huge problem in our society. And it's can be one of the most insidious ongoing challenges. Diet, regularity of diet, balance of diet. We would like to think that eating a good diet alone is going to produce, you know, perfect health. And the truth is that often we have to supplement, because what we have in our nutrients, in our food supply, is increasingly depleted of vital nutrients. I think it's important to be realistic with assignments, and sure, a big piece of success with patients is establishing rapport. and understanding exactly what's doable. And so we do this in stages.
Go to the hill.
I think that I understand human nature, being one myself. So I think it's important to have an advocate in health. I see my job as first an investigator and then an educator, and to empower my patients to make healthy choices on a daily basis once they understand what those choices are. And we have to recognize that we're all different. So it's important to identify what is the healthiest possible choice for each individual.